Okay, I'm gonna record this theoretically and post it on my YouTube later, so if you ever are like, man, I wish I had more dissection tips that I forgot, you can find it there. But basically the backstory behind this lecture was the Atlantic Vet College, one of the president of the Path Club there, he asked me if I would do a talk for them around October because they have like a pathology week over Halloween. So I made this lecture very Halloween themed, as you can see. Obviously it's not Halloween right now, but we'll roll with it. I still think it's appropriate. So today we're going to be looking at dissection tips for field necropsy. And I took out the About Me slides, but I think you all have had me at some point, so you should all know who I am. If you don't, that's me. So this lecture is going to be kind of a general overview of how to do a necropsy, and the emphasis is going to be on field necropsy, specifically of large animals. Although some of these tips are also applicable to in-clinic necropsies for small animals. As a pathologist, I'm kind of a weird one because I came into pathology really enjoying horses, and so most pathologists come in from small animal, and horses are really big and cumbersome to try and do a necropsy on, and consequently, I end up doing a lot of horse necropsies. I've also done a lot of field necropsies of, I have so many horse friends that just call me up and are like, hey, can you cut up my dead horse? And that's where some of these photos have come from. So yeah, we're gonna go over kind of the basic step-by-step process, and I'll give you some little tips and tricks along the way. So we're gonna start by looking at kind of the tools of the trade. We'll go through the general necropsy procedure. I'll talk a bit about sample submission, and then at the end we'll do a little poll everywhere game on lesions versus non-lesions, because you know I love a poll everywhere game. Okay, so we'll start with the tools of the trade. So your basic tools. You're going to have your hacksaw. You're going to use this to cut open skulls. You're going to have rib cutters, which are apparently their actual name is tree loppers. They're meant for cutting like big branches off of trees. We use them for cutting ribs. Table vices are really useful for holding skulls, especially if you're in small animal where you have a table that you can just stick the thing to. It helps with like kind of grasping the skull so it's not sliding all over the table as you're trying to saw into it. There's this little thing called a T-tool, which is basically like a little chisel or a little like prying device or a mini crowbar, and you can use that to pry open the skull cap once you've made your saw incisions. You're also going to want a variety of butcher knives and a sharpening steel to help keep your blade nice and sharp. And then I specifically mentioned rat tooth forceps here because a lot of the forceps that you guys use in surgery don't have like good grip to them. And in necropsy, it's already dead. You're not going to hurt the tissue by grabbing onto it with little bitey rat teeth. So I do find rat tooth forceps very, very helpful with necropsy, but don't use them in surgery. Other things you might need, a variety of surgical instruments like scissors, all that kind of stuff, gloves, jars of formalin, if you're taking a bacterial sample, bacterial swabs are really helpful, and then bags for your frozen tissue samples. If you're going to be out in the field, I highly recommend these rain bibs or like kind of waterproof overalls. Necropsy is a really bloody process, and so when you're kneeling down next to a corpse and there's blood all over the ground, it's really nice to have something waterproof on to keep the blood from soaking through your coveralls or your pants or whatever you're wearing. Safety goggles, and then the biggest one that I harp on people about is cut-resistant gloves. And the reason I harp on people about it is from personal experience. So I have two stories for this. The first one is cut-resistant gloves are going to help you prevent from cutting yourself. So I have a lovely scar on my thumb. That was how I bandaged it after it happened. And basically what happened was I was doing a field necropsy. I stopped to take lunch, so I took off my cut-proof gloves, ate my lunch, went back to necropsy, and I did not put back on my cut-proof gloves. And one thing that happens if you do a lot of necropsies wearing cut-proofs is you don't get very disciplined about what you're doing with your knife, because if you hit yourself, it doesn't really matter. And then the one time you forget to wear your cut-proofs, your lack of knife discipline will come back to bite you in the butt. And so that's what happened with me. I was cutting through something, my knife slipped, and I almost tried to remove most of my thumb. My other story for this is that I was down in necropsy with a vet student, a fourth-year student on rotation, and I was having her hold back the rib cage of a horse. And I had told them beforehand, like, put on a cut-proof glove at a minimum on your non-dominant hand, because that's the hand you're most likely to cut yourself on. And she had put on a cut-proof glove on her left hand, but then she was using her right hand to hold this thing open for me, and I went with the knife, and it slipped, and I cut right into her pinky. So if you're working with somebody else on a necropsy, you and that person should both be wearing cut-proof gloves on both hands. Otherwise, there is a risk you're going to skewer somebody with a knife. So cut-proof gloves, very useful. All right, so now we'll go through kind of basic necropsy procedure. So first, you're going to start with an external examination. So the first thing you want to do is confirm the animal's identification, especially if you're doing like cattle, or there's like, we've had in necropsy like 3 golden retrievers come in at the same hour, and it's like, okay, which one are you actually doing? You're going to want to check for any wounds, areas of swelling, skin lesions, that sort of thing. Once you get the animal open, it's really hard to kind of piece everything back together if you miss something on external exams, so do a really thorough exam. And then the last thing you're going to want to do is position the animal. So depending on who teaches you or where you're taught, you can learn like different varieties of this positioning. The way we do it here is that we put ruminants into left lateral recumbency. That means that the rumen is down, and therefore it's not going to come exploding up at you when you cut into the abdomen as much. And for monogastrics, we usually do in right lateral, so that way the spleen is up, so when we open the abdomen, we can see the spleen right away. However, I do know lots of pathologists that do everything in left lateral and do everything in right lateral. It's totally up to you. Just be aware of what you are going to see and what you might easily miss depending on the position of the animal. Before you do anything, check to make sure it is not an anthrax carcass. So one of the big clues is unclotted blood coming from the orifices. If you cut into an anthrax carcass, depending on who you talk to, you may need to take like 2 months of antibiotics. Realistically, the risk of you getting anthrax from cutting open a carcass is probably pretty minimal. However, it does also contaminate your environment with the spores, and so you could potentially cause a future anthrax outbreak just because you've contaminated the environment. So if you see an animal that you suspect has anthrax, either get it transported to a diagnostic laboratory, or you can do take a sample of blood from the ear, we usually recommend, because it's one of the last places to actually autolyze. And you can see little train track bacteria under the microscope if there is anthrax. And if you see that, don't open that animal. Then we're going to move on to skinning. So you're going to reflect the forelimb by cutting through the axilla or the armpit. And then you're going to reflect the hind limb by cutting into the inguinal region and disarticulating the hip. And if it's a large animal, it'll make a really satisfying popping noise, probably the best part about necropsy. Fresh dead animals, especially large animals, will kick you if you cut through their large nerves. So if you have, say you're out on a feedlot and they bring you a fresh dead while you're there, if you immediately go and cut open that animal and you cut through that sciatic nerve, it will kick out. And I always warn people about this, and they never believe me until they get kicked by a large animal. I also know a guy who he was sawing into the head of a horse to remove the brain, and he was using the front of the mouth as leverage with his hand in the horse's mouth, and his saw poked through the skull, hit the brain, and the horse bit down, and he lost the tip of his finger. So they will kick or bite you, even though they are dead. You're going to continue your skinning by making a ventral connection between the 2 openings, and then you're going to basically flop everything dorsally. Also remember, at this point, you can check out your hip joint before you proceed, so this is a really good opportunity to look for signs of arthritis, cartilage damage, as well as the nature of the joint fluid. If it's very low viscosity, that can be indicative of a septic joint. When you're doing your skinning, one thing that I see a lot of students do is that they cut through the hair with the sharp side of the blade. So they'll have like a haired animal and they'll cut down into it. Cutting against hair dulls your knife extremely quickly. So what I recommend is kind of flipping your knife over so that the cutting surface is pointing up, and then running it underneath the skin like you're cutting some wrapping paper or something like that. That'll help keep your blade a lot fresher, and it means you won't have to sharpen it quite as often. Then you're going to make your abdominal incision. So what you're going to do is you're going to cut along the end of the rib cage until you reach the peritoneum. And so the peritoneum is going to be that little like lining of the abdomen. And be aware that underneath there are intestines. So this is another place where it's good to use your knife upside down or cut inside out, because the back of your blade is not going to cut the intestine, but if you just go right down into it, you probably are going to end up poking something. So what you can do is use your forceps or your hand to just kind of pull up the peritoneum, poke through it, and then use that to extend your hole. And then from there, once you have the abdomen open, you can poke the diaphragm to test for negative pressure in the thorax. Here's another top tip. So if you stab the fermentation organs through the body wall before making your abdominal incision, your life will be a lot easier. And that's because it avoids two major problems. The abdomen is under high pressure after the animal dies, especially because their fermentation continues even though they're dead. So those organisms are still producing gas. And so those animals can bloat quite significantly, like you can see in that cow. And so when you cut into the abdomen, that means that all that high pressure has to go somewhere, and usually it's going to cause the organs to come exploding out at you the moment you cut into the peritoneum. Secondly, if you end up puncturing the intestine and it's a high pressurized organ, it will shoot GI contents into your face. And that is not fun. Yes?
Are you worried about rupturing like the organs and then having whatever's potentially inside obscure everything and not being able to see anything?
So when you do just like a stab incision, like literally I just like go to the left side of the animal and just in and out, the amount of leakage from that is going to be very minimal. However, if you are very concerned about something, like if you're wanting to be very sure about like a peritonitis or something like that, maybe avoid doing that as much as you can, just because there is a potential for leakage that you could conflate with a potential lesion. However, there are other clues whether something was ante-mortem or post-mortem. So it's not, it's a gray area, right? There's no, set answer to it, but it's a good recommendation, especially for feedlot cattle where you're not suspecting that bloat was the primary cause of death and they've been sitting there all day in the hot summer sun. Not fun to get shot into your face. You're then going to move on to your thoracic opening. So you're going to use a knife to cut guidelines for yourself in the soft tissue over the ribs. You use your knife to cut the guidelines. You do not use your knife to cut the bone. Only saws or cutters should cut bone. So this is where you're going to get out your tree loppers or your rib cutters and start cutting the ribs dorsally and ventrally. So you're basically making like a plate. And as a tip, if you cut a small slit between two of the ribs, you can use that as a little like handhold to help pull the ribs back as you're cutting so that you can make a nice section. This is how I cut that student. She was holding it for me and then I cut her. The new rib plate that you have just made makes a really great place to put tissue samples on because it's nice and clean and theoretically should be sterile unless your animal had like a horrendous pleuritis or something like that. But yeah, it's a nice area to just like set stuff on while you're doing the rest of your necropsy. So once you have the thorax open, your critter is now in display phase. So you should be able to examine all of the thoracic and abdominal organs. Next thing you have to do is decide what you want to do with the pluck. So you can either leave it in situ, take it out completely, or use a pluck table. So we'll go through kind of those options. So in a traditional necropsy, you would just take out the entire pluck. And so what you do is you cut between the mandibles and on either side of the tongue, and then you basically flip the tongue down between the mandibles, grab onto it, and start reflecting it ventrally. And then, as I say a lot of the time in anatomy lab and pathology lab, cut where you see tension. So if you're pulling on something and you cut where you see tension, eventually you will end up with that thing in your hand because you're going to cut it away from whatever's holding onto it. So while you're doing that, you're cutting where you see tension, you're going to eventually run into the hyoid apparatus, which is all those little like bones that are all kind of at nice angles. It's really easy to disarticulate those just by placing the sharp point of your blade into one of the V shapes that the hyoid bones make, and then just cutting up. And it'll come, you have to do it on both sides, but it'll free up the tongue nicely. And then you just keep going. So you keep pulling the tongue, cutting where you see tension. Eventually you'll end up with the trachea and esophagus pulling away from the neck. And then once you get to the thorax, you cut the esophagus, caudal vena cava, and aorta right next to the diaphragm. And now you have everything from the tongue to the back of the lungs as a free structure that you can do whatever you want with. When you're doing this in horses, it can be really difficult to flip the tongue out from between the mandibles because they have a really narrow jaw up front. So what you can do is you can take your rib cutters and cut the mandibles on either side, and that'll just give the jaw a little bit more movement back and forth where you can have more room to actually get that tongue out from between the mandibles. So one thing that you can do as an alternative to kind of taking out the whole pluck is you can do what's called a pluck table. So when you're making your initial thoracic plate, basically, if you keep the first rib attached, you can kind of flip it over and then use that rib cage as a table resting on the animal's front leg. So then what you do is you cut the caudal vena cava, aorta, and esophagus, and you can just flip the whole set of lungs and heart out onto that table that you've made, and you can do whatever sort of examination you need to. However, if you're going to do this, do remember to go back to the neck and examine the trachea and esophagus because you're not actually pulling them out using this method. The main benefit of this method is that there's no loose parts. So if they have to move the animal afterwards, they really don't like when there's like things falling out of them as like all the time. So this is one strategy you can use to kind of keep things more self-contained. And then the final method would have been just leaving it in place. That is completely valid. That's what a lot of feedlot practitioners do. They just leave it all in there. But be aware you're not getting a really good look at the downside lung. You're not getting a really good look at the opposite side of the heart unless you take it all the way out, things like that. So it's a kind of a risk assessment you have to do about how thorough do you need to be with your necropsy while also balancing disposal factors. So once you have your pluck out or accessible, you should have access to every organ except for the brain. And so this is where you're going to start examining the organs for lesions. And you're going to start with the non-GI organs. So you're going to bread loaf any solid organs, which is what's happening to that spleen up there. You're just going to cut little lines in it. And that's going to allow you to kind of visualize the interior surface of that organ at multiple different areas because you might miss like an abscess or something if you don't do the whole organ. So these are going to be organs like your spleen, liver, kidney, etc. And then you're also going to open any tubes, so the esophagus, trachea, leave the GI organs for now, but make sure you're looking at everything as you're going along. The heart is very large, heavy, and slippery in our large animals. So one strategy you can use to kind of help maneuver it around is cut a small slit into the bottom of it to use as a handhold. You can stick a couple fingers in there and like really reef on it, and because of the thickness of the ventricular wall, it's not going to like tear or anything. And so that's one way you can use, or one strategy you can use to help pull it out of the thoracic cavity, especially if you are leaving the pluck in place. A lot of feedlot guys will do this just to help get it actually out so they can see it. And I said to leave the GI organs for last. That's because they're most likely to contaminate your other tissues. There's lots of gross, poopy stuff in the GI tract, and we don't want that to get all over our nice, clean other organs. So if you're going to be doing any sampling, make sure you do that first before you even touch the GI tract, because the moment your blade cuts into the GI tract, now you're going to contaminate all of your other samples if you go back and try and take a section of spleen, for example. When you're doing the GI organs, you can actually flip them up onto the hind limb and kind of use the abdominal skin and hind leg as sort of a table. Or you can go and cut the mesenteric root and scoop them all out and lay them out. That's usually what we do in pathology lab, but again, for feedlot people or field necropsies, you're trying to minimize the amount of loose parts, so usually people just kind of fish around in there after flipping it up onto the hind limb. If you are taking out the GI tract, this is more for small animals than anything else, but if you tie it off with string before cutting, it just keeps everything really clean. So you can tie off at the rectum and at the end of the esophagus, and if you place 2 ties at each location and then cut between them, you'll end up with a sealed tube, and then you have basically a GI tract that's not going to leak all over everything else. So that's kind of a nice way to keep things more clean. And then we get to the brain. So you can either use a saw or an axe, depending on your preference. The axe is faster, but it's more likely to damage the brain for obvious reasons. The traditional in-lab technique is to remove the head and then saw into the skull. So the way to remove the head, this also applies for like if you have to submit for CWD testing or any of those types of diseases, rabies too, where you're submitting the whole head. The best approach is to go from the ventral side, so you go underneath the animal's jaw, and just start cutting down until you get to the C1 occipital joint. You're going to kind of wiggle the nose back and forth so you can feel where the joint is. Stick your knife in there. You can kind of wiggle it back and forth to cut the ligamentous attachments on either side, cut through the spinal cord, and then if you keep pushing the head, like dorsiflexing, so back against the way that it would normally sit, you can just keep cutting, cut where you see tension, and eventually the head will come off. So that's what it looks like when it's off. It's just everything is cut right at that C1 occipital joint. Once you have done that, you're going to want to get to the brain. So you're going to skin the dorsal aspect of the head, and then you're either going to place it into a table vise or you can place it on like a non-slip surface. I know a guy who has a very large vise that he kind of welded onto a ball hitch for his truck. So when he's out doing feedlot necropsy, he can just stick the head in this giant vise that he just shoves into the ball hitch of his truck. Ingenious idea. So that's another thing you could do. And then what you're going to do is you're going to make two cuts using your hacksaw, and it's ideal to follow the angle of the occipital condyles. So here's the occipital condyles, and see how they kind of have like a diagonal line to them? If you just set your saw on that angle and start going, that's like the perfect angle to actually get around the brain and be able to get that brain case off. And then what you'll do is you'll make a third cut across the front to connect them. From there, you're going to take your T-tool or your chisel or your crowbar or whatever you're going to use to get leverage on that piece of skull, and you're going to wedge it in there, pry up on it to crack the skull along the cut lines, just get any last little bits that hadn't actually cut yet, and you should then have an exposed brain. If you're using an axe, you can do 3 cuts in kind of a similar placement to how you cut with a saw, and then you can either use the end of your axe or a chisel to help pry up that skull cap. You can also whack it with the back side of the axe to help remove any bony attachments that are remaining. But yeah, it's just different strategies to kind of do the same thing. Once you are about to remove the brain, you're going to basically use scissors and forceps to cut away the meninges. And then I find it really helpful to flip the head upside down to allow the brain to kind of hang off of its cranial nerves. And then what you can do is you can get a little pair of scissors and stick them in between the brain and the underside of like where the skull or the brain sits, and start cutting those cranial nerves and meninges on the ventral surface. And if you kind of keep working away at it, eventually the brain will just fall out into your hand, and then you have a brain. For very small dogs and a lot of cats, except for like really big tomcats, you can actually use rongeurs, which are like the little like kind of nutcracker peely things, to actually like peel away the skull rather than using a saw. So you kind of just go at it like you're peeling a hard-boiled egg. And the benefit of this is that if you're using a saw, the skull bone is so thin there that like you're going to end up cracking into the brain, like you will saw through your brain. So this is a nice strategy to kind of make the brain more intact at the end. Yeah. No, I just go right at where the occiput is. I just start kind of cracking as I go up, and you just literally peel it like a hard-boiled egg. Yeah. All right, finally we get to disposal. So disposal of an open carcass can be challenging, as there can be a lot of loose parts, as I mentioned. So if you know that the animal has to be moved after you're done with it, try and keep things attached whenever possible. You can also use umbilical tape or baling twine to sew back up an animal. You just make some stab incisions with your knife and just shove the material through, and just kind of do like a rough, like this is not surgery suturing class, like just get it tied up so that they can move the animal wherever it needs to go. Remember that if it is a barbiturate euthanized animal, it has to be buried really deep. Like I believe it's like under 6 feet into the hole, like before, like 6 feet down and then the animal. So your hole has to be quite deep if it's a horse or a cow or something. So if burial is not possible, or there's a risk of scavenging. So for example, I once had to go and euthanize a horse that fell down into a ravine. And so he was probably like 30 feet down a sheer cliff, and there was no way in hell we were going to get him back up that cliff. So in those cases, there's kind of a couple of options: gunshot, captive bolt, and then one I really like and I think is a really nice method of euthanasia is intrathecal lidocaine. So In this procedure, you put them under general anesthesia, you take a spinal needle and you pop it into the dura, basically around the spinal cord, and you put in about 60 mils of lidocaine. They basically go brain dead instantly because it just goes right back up to the brain, and then they stop breathing eventually once their brain kind of, as it's shutting down. But it's really, really nice. There's no sudden drop like you see with barbiturate euthanasia because they're just going under GA to start. And yeah, it's a nice procedure. So keep that filed in the back of your brain if you're out, especially doing field stuff. Okay, and then a question I get a lot is sample submission. So there are kind of a few different types of samples that you want to collect, and it depends on your disease suspicion. At a minimum, we recommend gathering both formalin fixed and either fresh or frozen samples of heart, lungs, liver, kidney, and spleen. Yes?
With the intrathecal lidocaine,
Yep.
do you find that you have to suck out some of the
Yeah, so they do recommend that you take out cerebral spinal fluid and then put the lidocaine back in. I've done it both ways and haven't really noticed that much of a difference, to be honest. It just depends on the size of the animal. For smaller animals, it's better because they just don't have as much space in there to actually like put anything in. But for horses and cows, you can do it just shoving it in. So. Okay, so when you're taking your formalin fixed samples, you want to follow the 10-10-10 rule. So at least one diameter of the sample should be less than 10 millimeters. You want to use 10% buffered formalin, which this like drives me batty. But so what we call formalin is actually a 10% solution of 40% formaldehyde, which is very confusing when you actually sit down and think about it. But anyway, 10% formalin. And then you want your formalin to tissue ratio to be at least 10:1. So when you're thinking about taking samples, just try and kind of keep those rules in mind. What you're going to do for your parenchymal organs or your kind of solid organs is take your scissors or scalpel and make a little square. Try and avoid squishing the sample with your forceps or your hand as much as you can. It can be really hard because things are slippery, but just to avoid some like squish artifact for the pathologist. And make sure that you sample multiple areas of every organ. So for example, for the lungs, make sure you take a sample from each lung lobe, that kind of thing. For your tubular organs, depending on the size of the animal, you can either take a whole donut, which is usually what we do for like small animals, or you can take a piece of the wall for a larger animal. Like you're not going to fit a cross section of the large colon of a horse into your jar probably, so you can just take a piece of the wall in those cases. When you're doing that, avoid rubbing the inner surface. People always want to get all the poop off before they put it into the formalin. Don't rub or scrape it. If it is really contaminated, you can just like hold it with your forceps and dunk it in water a few times, and that'll free up some of the contamination. Or just throw it in. It actually doesn't matter for the formalin. It'll fix all the same. So just avoid rubbing that inner surface because that kind of destroys all the nice villi and stuff that we would be looking at as the pathologist. And then make sure you take sections of all areas. So do sections of all the parts of the small intestine, all the parts of the large intestine, that kind of thing. For the heart, it somewhat depends on the size of the animal, but a lot of the time we recommend doing these T sections where basically you cut across the heart and make it like a little 1 centimeter tall cookie, and then you're going to cut the T off of the end of one of the sides, and that gives us a section of left ventricle, interventricular septum, and right ventricle all in one. And then once you've cut that T, you can cut the little sides to make it a bit smaller. You don't need to like leave the whole section of ventricular wall in. If you see any lesions, it's important to sample them. Ideally, you want to sample the lesions at the junction of normal and abnormal. This gives us something to compare to, and it also just means that we can see the change. So a lot of lesions that we commonly see in pathology are actually necrotic at the center. So if you sample the middle of the lesion, all I can tell you is that is dead tissue. I can't tell you why it's dead. I can't tell you what caused it. So if you sample the edge, that's kind of the advancing front of the lesion, and I can actually see what changes are occurring in that area. Containers. So what you want to put your formalin fixed stuff in are these plastic containers. Make sure that they are labeled as containing formalin. It is a carcinogenic substance, so if it spills, we want to be able to know what we should do for cleanup, things like that. Ensure that the lids are tightly closed before you ship them anywhere. You can always tape them shut if you're worried about it. And then take those containers and put them in a sealable plastic bag as just an extra assurance against leakage. For larger specimens, please make sure the opening of the jar is not narrower than the jar itself. Otherwise, we can't get the specimen out. So one of the things that formalin does is it makes tissues really rigid. And I got a small dog leg, an entire hind limb, and they had put it in a protein tub like this. But when they put it in like hock first. So it bent, and then they shoved it in, and then it opened, and then it fixed that way. So then when I got it to try and take it out, I couldn't bend it back because the formalin fixation had solidified the tissue in the open position. And I actually had to take the tub into necropsy and use a saw to get the thing out so I could do the assessment. So yeah, just as a tip, please keep your pathologists happy. You know, I know we're little like basement dwelling nerds, but we also have struggles like people submitting things in the wrong containers. Very cold weather can also freeze formalin during shipping, and it can make tissues unreadable. So if you fix something for at least 24 hours in formalin, you can then transfer it to 70% alcohol for shipping, and that'll prevent it from freezing while it's like out and about in the world, getting shipped to the pathologist. So this is really helpful, especially for like small animals where you're like taking something off in surgery and you want to send it in for pathology. If you fix it first, then when it comes to us, we know that it's at least not been frozen because it'll be in alcohol. Then you're going to want to collect fresh and frozen tissues. So we usually collect these for toxicology, virology, bacteriology, all of the ologies. Sample size is not as important for collecting these, but you also don't need to send us the whole organ. Sometimes people do that. I'm not really sure why, but you can just send us something that's about 2 to 3 times larger than what your formalin fixed sample was, and that should be enough for most of the different types of testing that we do. We often ask for fecal contents to help diagnose GI diseases. A really nice way to do this is either just tie off a short section or like a loop of the intestine to trap the feces in it, and then put that whole loop or section of intestine into your bag and then ship that as fresh frozen. So rather than trying to like cut open the intestines and milk out a bunch of feces into a jar, this is a lot faster and a lot cleaner, to be honest. When you're shipping something for fresh frozen, it's important that it's somewhat sterile to prevent cross-contamination. So if you're using like a Tupperware that you've used for your soup before or something, like there's a potential that there's bacteria in there that could then be confusing when we get the bacteriology report later on. So these Whirl-Pak bags are just like a little plastic bag. They're ideal. They're sterile on the inside. You tear off the top portion, you stick your tissue in, you roll up the top and secure it with the little yellow tabs, and then you can just use a permanent marker to label the tissue type and the case number for the pathologist. And I said fresh or frozen. You might be asking, well, which is it? Is it fresh or is it frozen? It doesn't really matter for our bacteriology, virology, etc. testing. But whenever possible, fresh is preferred. You can ship them with ice packs to help keep the specimens cool. But if there is going to be a delay between sample collection and the time you ship them, it's better to freeze them just to prevent any like decay, especially if there's bacterial overgrowth from after death. It can obscure what we would have found for bacterial testing from the animal's actual disease. And again, you want to ship any frozen samples on ice. And then what should you submit? It really depends on the tests you want to perform and what you suspect clinically as a disease. If you're ever in doubt, just call the laboratory. They will have like a good guideline on what samples you should submit for the disease you suspect. If you're looking for a pathogen, always submit the most affected organ, so whether that's the GI tract, lung, etc. For toxicology testing, we usually recommend submitting the liver. But if you send us a full panel of organs, that's cool too. We can, pick which ones we think would be the most appropriate for whatever kind of test you've ordered. Okay, so now we're going to just do a fun little quick game at the end for non-lesions versus lesions. There are post-mortem artifacts or like normal findings that can look like lesions. As you gain necropsy experience, you'll become more familiar with these. You also need to take into account the animal's history. If you find something weird and the animal has no history of it, it is more likely perhaps to be a post-mortem artifact. if you're ever in doubt, just sample it and we can tell you what was going on with that tissue at histology. So this is an example of liver mortis in a pig. So basically the pig dies and then the blood coagulates under the skin, and now you've got a funky looking pig with a fun pattern. Not disease, just a consequence of death. So you guys can join the poll everywhere, and we'll just play lesion or non-lesion. Okay, we're a little over half non-lesion. Does anyone want to guess what this is? Yeah, so this is barbiturate precipitation. So especially when you do like intracardiac euthanasia, barbiturate salts tend to precipitate out on the organ surfaces. And so if you do like intracardiac or intra-abdominal, sometimes you'll see little crystals on the organs. And it's not a lesion, it's just the barbiturate salts kind of coalescing on the organ surface. Liver from a horse, lesion or non-lesion? All right. Any guesses as to what this is? No? Okay, so this is a non-lesion. It's called a diaphragmatic tag. So basically, we don't actually know what causes these. We thought it was due to parasitic migration for a long time, but as we've increased our deworming practices, we haven't seen any real change in how frequently we see this finding. So what we think is happening is that the liver, as it's rubbing up against the diaphragm as the horse breathes, it produces a little bit of scar tissue just from irritation, and then we end up with these little like either tags or kind of coalescing lesions like you see in this one. That are just scar tissue from something. We're not really sure, but that's kind of the going theory right now is diaphragmatic irritation. Liver from a horse, lesion or non-lesion? – 50-50, nice. Okay, this is, anyone want to guess? Tension lipidosis, very good. Second years, they know their cis path. So this is tension lipidosis. Basically, wherever there's a ligament that's holding on to the liver, sometimes we see lipidosis in the immediate area due to like tension pressure on the liver. And so that is not a lesion. The horse does not have hepatic lipidosis. It's just a small area where the hepatocytes just can't function properly because there's a lot of tension on them. Spleens from dogs. The bottom one is the one we're looking at. Lesion or non-lesion? You guys are much more confident on this one. What is it? Barbiturate euthanasia. Yeah, so barbiturates can also cause basically vascular stagnation, and one of the main areas that it affects is the spleen, so you get these really big juicy spleens from barbiturate euthanized animals. Esophagus of a cow, lesion or non-lesion? You are studying right now. All right, any guesses? Bloat line, yeah, so this is basically congestion of the esophagus where cranial to the bloat or pallor of the esophagus in the bloat, where basically the animal's abdomen and thorax are so enlarged that it cuts off circulation to part of the esophagus. Spleens from pigs, lesion or non-lesion? All right, so it is a lesion. Any guesses at causative agent? African swine fever is one of the main causes of splenomegaly, or like, I guess I wouldn't say main cause, but it is a thing you should be aware of because that is a foreign animal disease, and if you identify it in a pig in Canada, you should be calling people. So just as a general rule, if you see splenomegaly in a pig, just be aware it could be a foreign animal disease. I think the bottom one's just kind of necrotic, to be honest, like post-mortem necrosis. But yeah, he's not looking like too hot either. So okay, stomach of a horse, lesion or non-lesion? All right, we're very confident we see that this is a lesion. Any dissenters want to argue why it's not a lesion? Yeah?
Is it a stomach ulcer?
It's not a stomach ulcer, it's actually a stomach rupture. But why is it not a lesion? What's the clue?
There's healing.
There's no healing. There's no healing and there's no what? Hyperemia and no bleeding. So if a stomach of a horse ruptured while the horse was alive, you would expect there to be a lot of bleeding. There is not a lot of bleeding, and so this is post-mortem. Fairly common as we move horses around after death for them, especially if they had eaten a bunch right before they die, for their stomachs to rupture. Eyes from a cow, lesion or non-lesion? It's missing? Oh no. Hold on, let's see. Now does it work? There we go. Someone responded. Okay. All right. Another 50-50-ish. Any guesses? Not a cataract. So cataracts do look like this. Don't get me wrong. This is actually a non-lesion. When animals are exposed to cold temperatures after death, like they're put in a freezer or they're left outside when it's minus 52, like it was last night, their eyes will actually cloud over, and it's not a pathologic lesion. It's just due to changes from freeze-thaw, basically, within the lens. Kidney from a sheep, lesion or non-lesion? All right, any guesses? So this is a non-lesion. This is called pseudomelanosis. Nice, yeah. Yeah, basically it's after death bacteria that are like hanging out in the pig kidney or sheep kidney. They change pigmentation essentially, and then you end up with a black looking kidney, but it's because of processing of sulfides, not because of anything that was actually going on with the animal. Brain from a dog, lesion or non-lesion? All right, any guesses? It's hemangiosarcoma in the brain, so that's a lesion. However, those can look a lot like some non-lesions. Kidney from a horse, sort of looks like that sheep we just saw. Is it a lesion or a non-lesion? Dissent. Guesses?
Renal pelvis necrosis from
No. Good thought when you have horse and kidney together, though. Those very good. This is red maple toxicity causing hemoglobin uric nephrosis, basically. So there's too much hemoglobin getting processed by the kidneys, and it dyes them like black to red. Liver and lungs from a pig, lesion or non-lesion? All right, guesses? Melanoma. Not melanoma. This is melanosis. So in a lot of our large animal species, like sheep, horses, cows, pigs, they can just get these little random melanin spots over their internal organs for, I don't know what the reason is, but they get them. And a lot of people confuse them for, metastatic melanoma, things like that, but they're actually completely benign. Liver from a dog, lesion or non-lesion? All right, Non-lesion, what are your guesses? You seem very confident it's a non-lesion, so what is it? Okay, so this is bile imbibition. So basically, we've got the gallbladder sitting there, right? He contains bile, which is green. And when animal die, gallbladder wall starts to get really sad and, starts to get kind of leaky. And that bile, with its green pigment, can leak out to the surrounding organs. And then you end up with green or black staining on those organs. Yep.
Can you get that from a cystic duct in a horse or not really?
You can, potentially, yeah. Like if they, for whatever reason, had a lot of bile in there at the time, you could see it. I don't know that I've ever seen it, but I also don't really go looking for it, so. Ilium of a horse, lesion or non-lesion? All right, what are your guesses? Any? Okay, so this is hemomelasma ilii. It is a non-lesion. We don't know what causes it, but I think the current theory is that it has to do with parasitic migration, as many things do in the horse. But basically, yeah, they're these dark pigmented spots that you primarily see on the ilium, and they have no consequence to the horse whatsoever. All right, so that was the last one. You guys know how to reach me. Like I said, I'll probably be posting this on my new YouTube channel. Like and subscribe, guys. But yeah, if you have any other questions, I'm happy to answer them.